Good morning, Dr. Sanjay Krishnan.
Very good morning, Akshat.
First of all, it's a pleasure to have you here in our show, sir.
Pleasure is mine.
Today we are here to cover a very common topic that most of the youngsters and people of different ages used to face, that are psoriasis. So moving towards my first question, what is psoriasis, sir?
Like I discussed with you in my earlier episodes about various skin diseases, psoriasis is also one of the skin diseases, which is basically, you can say, it's a papillosquamous disorder in which you have silvery white scales spread over the body, especially more so at the site of trauma. And both the sexes are equally involved in this, and sometimes we see that if you scratch these silvery white scales, then the lesion starts bleeding also. And the cause, you can say, is emotional upset can also trigger off this problem.
Emotional upset.
Then is stress. Then sometimes you have genetic predisposition, and sometimes you have other emotional upsets.
Sir, can you please explain this term genetic disposal?
By genetic predisposition, I mean that if the father or mother is having this disease, it can equally transfer it to the offspring.
Okay.
So that is genetic predisposition.
Inheritance.
Inheritance.
Okay.
Yes.
What are the causes of cirrhosis?
Somebody is under a lot of stress, not able to express, right? So it gets pent up inside, and the nature expresses it in some other way. So psoriasis is one of them, right? If you are having some stress, not able to express it, not able to relieve it, you can also come under the grip of psoriasis.
Can I know the basic Hindi name of this psoriasis?
We call it psoriasis only.
We call it psoriasis only.
Yeah, and you have some lesions out, silvery,
on the body,
fishy,
on the skin.
Yeah, scales on the elbow, sometimes on the knees.
Okay.
Sometimes it is bilaterally symmetrical, means if you find it on
exactly
left knee, then on the right knee as well.
On both sides,
and sometimes you see there are certain diseases which also just aggravated, like diabetes also aggravated. And if your lifestyle is faulty, then it can be triggered off. There are n number of causes for psoriasis.
For psoriasis.
Yeah.
Does it contagious?
It is not contagious.
It does not spread.
Yes. If somebody is having psoriasis, it doesn't mean that he is going to spread it to the colleague. No.
Okay. Does it affect other parts of body like nails, joints?
It can affect. It can affect the nails.
Nails.
Skin is already involved. It can affect the joints. When it affects the joints, we call it psoriatic arthropathy. And when it affects the nails, you have the pittings on the nail, small pinhead size pitting on the nails, which is basically characteristic of psoriasis.
Coming up to the joints, does it have a specified symptoms from which we can know that it's a psoriasis kind of arthropathy?
One of the most important thing is the person who is having this arthropathy must have a history of psoriasis. Okay. So this is how we are able to just link up the disease with the joint problem.
Okay. What has homeopathy offered to psoriasis patients?
The best part that we offer to the patient suffering from psoriasis is modification of the lifestyle, eating habits, yoga, and medication.
Medication.
One has to be very close to the nature, in the lab of the nature, I would say, and drink plenty of water. All those things which basically dry up your body water, like taking too much of tea results in too much of urination. So that basically depletes your water level. So tea I would not recommend to patients suffering from psoriasis. Similarly, if they have got any habit of drinking, having alcohol, they booze a lot and they smoke a lot, so that is to be shunned. that has to be stopped basically.
Does psoriasis harms if it stays for a long time?
Definitely anything which is unwelcomed is going to harm to the body in the long run.
Okay. Does it completely go off by homeopathic treatment?
Yes, as I said that besides medication, I also lay emphasis on lifestyle and diet management, yoga, and the person should be friendly with the nature, not away from nature. He should have fresh air, must keep himself in the lap of nature, have fresh air, do alone below. By doing this, you basically optimize the level of oxygen in the body. Like you see, we have started.
Let me mark my question. Does it completely go off with homeopathic treatment?
Yeah, definitely.
It will go completely.
Yeah.
Means it will not reoccur if we once go for a homeopathic treatment.
Yes.
Thank you. This was Dr. Sanjay Krishnan. Now, we have given all the details of Dr. Sanjay Krishnan in our previous videos, and also we have given his detail in our description box. Now, please don't forget to like our channel, subscribe our channel, in order to create a healthy environment every